All right, let's get started, everybody. Welcome to our April Advocate webinar for today. We're going to talk about accumulator adjustment programs as the core of our discussion today. And on the call, it's Julie Ellers, that's me, Manager of Grassroots Advocacy, along with Anna Hyde, our Vice President of Advocacy and Access. And we're excited to talk to you all today about some Take Care initiatives that the advocacy team is launching this year. As we go through the webinar, if you have any questions, please feel free to type them in the Q&A feature or in the chat feature as we go through, and we'll address them either during our discussion or at the end of the webinar. We'll have a time to do live questions, so you can hold them to the end and ask them on the phone later on. So to start off, we want to talk to you all a little bit today about a new blog series that we're launching called Take Care. These blogs are going to be coming out every other week over the next 2 months, and we're going to be posting about different administrative burdens that you all are facing in health policy and how we can help address them. We are trying to drive this series by you, by your feedback. In our most recent advocate survey, you let us know that administrative burdens are one of your top concerns in accessing your care. And so we want to take a deeper look at what some of those are and really provide you with some tools and resources to tackle them. And in the first of our series, we're going to be talking about accumulator adjustment programs. And so I'm going to pass the microphone over to Anna Hyde to give you a deeper understanding of what accumulator adjustment programs are in our webinar today. And then we're going to follow up with this webinar with a blog post and even some feedback opportunities through the Twitter chat. Before you get started, I'm going to remind you to please mute your line so that we can have the best recording possible and so that everybody can hear us as we go through. Okay, Anna, mic's to you.
Hi, everyone. Glad to be here with you today. So accumulator adjustment programs is probably a term that you're not familiar with. It's not a household term for most of us. But this is a new policy trend that we're seeing in particular this year by some pharmacy benefit managers and health insurers that are affecting the way copay cards can be used for your deductible. So accumulator is a term used to refer to your deductible or out-of-pocket maximum. So before we dive into what this really means, let's take a step back and talk about copay assistance generally. Many of you are aware or even use copay assistance from your drug manufacturer, particularly for specialty drugs that can be more expensive. These copay cards are often really critical for patients to have access to in order to help pay their out-of-pocket cost expenses. And what we have seen over the past couple of years are increasing barriers to how copay assistance can be used. Oftentimes, by the time you have exhausted your copay assistance, because many of these copay cards do have caps on the amount of financial responsibility that they give, you will have met your annual deductible because we're talking in the thousands of dollars in many cases. So I just want to sort of frame that as to why copay assistance is so important to so many of our patients. The Arthritis Foundation itself does not take a position on copay cards, whether they're good or bad. Our goal is to make sure that patients are able to stay on the medications that they need and that they have access and that they're able to afford them. So let's return back to accumulator programs and what this actually means. So really at its basic level, an accumulator adjustment program is a program that does not allow copay cards from your manufacturer to be used to help pay for your deductible or to count to your out-of-pocket cost maximum. So what this means is that once you have exhausted the limit of your copay card, you are then responsible for the full cost of your deductible. So let's go through an example. It's January. It's the start of a new health plan year, and you're on a biologic that has a list price of $3,000 a month. Traditionally, you will have been using your copay card at the pharmacy counter and then just paying a copay, and that financial assistance from the copay card has been going towards your deductible. Under the accumulator adjustment program, that last piece is not happening. So by the time March arrives, let's say you've reached the limit on your copay assistance, and you go to the pharmacy counter in April, for your refill, and you're expecting to pay your traditional copay, and instead you are charged with the full cost of your drug because you have not met your deductible. So let's say you have a $6,000 deductible and you're on a $3,000 a month drug. You're going to be given a charge of $3,000 each month until you've satisfied your deductible, and then your more traditional cost-sharing help kicks in. So go to the next slide. What does this mean for patients? Well, it can mean a number of things for patients, and let's start with just basic awareness. You know, your health plan may have disclosed, or even your employer may have disclosed that you might be enrolled in these programs, but every disclosure is different, and as we all know, you get disclosures from your insurance company all the time, and you may or may not fully understand the terms of it. So one of our big goals is to make sure that patients are aware if they are enrolled in these programs, and that they kind of know where to go and what to do if they're going to be impacted. So at the end of the day, just given the example that we just went through, it's really, are you prepared to pay the full cost of your deductible if you're enrolled in these programs? That's where our focus is now. Okay, so let's go up to this 20,000 foot level for a minute. Why are PBMs, insurers, and employers using these programs? So PBMs and insurers often argue that co-payment assistance keeps drug costs artificially high. They sort of mask the true cost of the drug and your true out-of-pocket obligation, and oftentimes that can incentivize patients to use higher cost branded drugs when lower cost drugs are available. And in many therapeutic classes, that is a very valid argument. There are some, though, and I think arthritis, rheumatoid arthritis is an example of this, where there are no generics for the biologic medications, and oftentimes, you know, there really aren't lower cost drugs, at least to a large degree. So that's sort of the PBM and insurer side, and again, that's not something that the Arthritis Foundation necessarily takes a position on, but we want to sort of lay out all of the different sides of this and provide the full context. On the employer side, employers have many costs to manage as well, benefits not just in healthcare but otherwise, and you know, oftentimes programs like this that are offered up to them as a savings, it would be a cost savings to the employer. It's an attractive offer to them, and they may not be fully aware of what the implications could be to their employees. Healthcare is a business, of course. There are many stakeholders that inform the policies, those directly in the healthcare delivery system, but others as well, like employers, so that's another key stakeholder here. All right, so as I mentioned before, our goal is to make sure that all stakeholders within this healthcare delivery system have the patient perspective in mind. So what we've been working on over the past few months is to try to collect some information from you all, from our patients, about how you might be affected by this type of a program. Those of you who may be enrolled in these already and are aware of it, to get some feedback from you, and from those of you who may not be, just what your levels of knowledge are about whether you are enrolled in these types of programs or not, what you would do if you got to the pharmacy counter and were given a $3,000 bill, how it might affect your ability to access your medication. So we can go through that in a little bit greater detail in a minute, but first, who is enrolled in these types of programs? The people most likely to be enrolled are people in employer-sponsored plans and those in high-deductible health plans, because if you're in a high-deductible health plan, you're more likely to have those, you know, $3,000, $4,000, $5,000 plus deductibles, in which case that big sort of upfront charge you're going to be responsible for. We know that high-deductible health plans are becoming increasingly common as you know, employers, again, are trying to both manage their own costs but also incentivize appropriate healthcare utilization and lower costs, and that the high-deductible health plan could be a lever to do that. Increasingly, though, oftentimes high-deductible health plans are the only type of health plan that are offered by employers. We're seeing that as a growing trend as well, so that's the other component of this. It's not isolated necessarily to employer-sponsored plans. We're not entirely sure how widespread these programs are, but we know that particularly for high-deductible health plans and employer-sponsored plans, this is an area of focus. Okay, so what can we do to address any sort of patient concerns that you might have around these programs? Well, healthcare costs, of course, continue to be a complex issue for employers, for patients, for everyone involved in the healthcare system. So part of what we want to do is adequately communicate what the patient concerns are to all of the stakeholders. Like I said before, your employer might not be aware of how these types of programs might impact you. It's important for you to have those conversations with your employer, with your insurer. We'll talk a little bit later about some specific things you can do to both find out whether you're in these types of programs, and then if you're concerned about them or have questions, what you can do. But for now, our job really is to make sure that the patient perspective is present in all decision-making about healthcare. So doing stakeholder outreach is going to be a big area of focus for us in the coming months. And of course, having your perspective and data about what's going on with you is really critical to that. So we need you to share your stories with us. That's one of the most important ways that we know what sort of challenges you're having and what we can do to help you. So I'm going to now turn it back over to Julie so she can talk about our story banking opportunities and then specifically what you can do to find out more about these programs.
Thanks, Anna. So let's talk a little bit about our story banking program that we can use to collect some of your stories about these Accumulator programs. We have on our website this new tool that will allow you to go in and check out some of our prompting questions. It's available through our Action Center, which is at advocacy.org, and then you can just click the button for Action Center and it'll bring you right here. This is one of our top action alerts. And what we're asking you to do here is quite simple. Just to reflect on your experience and make sure that if you are having trouble with one of these programs or you're experiencing one of them, that you're letting us know about it. And the reason that it is so important is that we directly will look at your story and collect many of our arthritis community stories so that we can direct our advocacy apps and we can make sure that your voices are being heard so that they truly are at the center of those decisions, so that the patient perspective is truly there. So some of our prompts for this particular story bank are, has your insurer refused to accept your copayment card? Have you been required to pay your full deductible after your copay limit was reached? How would your care be impacted if you were prevented from using your copay card towards your deductible? And our goal in asking these types of questions is to really help you kind of reflect on your experience and share that back with us. So I encourage you to go online and check it out. And we'll be including this along with our recording of this webinar in our next Advocacy in Action email. So what are some other ways that you can take action? Well, Anna really hit the nail on the head in making sure that our voices are heard across the full healthcare spectrum. So the first thing you want to do is really understand how your care is impacted by these programs. So you'll want to consult your health plan materials or call your insurer to ask any of the questions that you have. It's important to have some clarity on how these programs and plans apply to you so that you can anticipate these charges if they're coming down the pike and so that you can have the best game plan moving forward. As these details come into focus for you, again, I encourage you to go back to that story bank, talk to one of your state directors, and share those stories with our team. The next thing that you can do is talk with your employer and your human resources department. One of the reasons that that is important is, like Anna said before, your employer might not even realize the full breadth and depth of the impact that these programs are having on their employees. So it's important that we share that story and are that voice in this situation. The other part of it is your human resources department might have a resource for you as you navigate the next steps in this process. The Arthritis Foundation has two other tools that I want to make sure we mention. The first is the Your Coverage, Your Care Toolkit, which is a part of our Prescription for Access resource package. The Your Coverage, Your Care Toolkit is a great way to identify ways you can interact with and navigate your coverage and insurance. I encourage you to check that out. It'll give you some more tools in how you can consult with your health plan. And the last tool that I really want to emphasize and mention before we move into our specific question and answer period, the call line or call our helpline at the Arthritis Foundation, where you can talk with a licensed clinical social worker 24/7. Some of the questions that I see coming in are very much patient-specific, and we won't be able to dig into all of the details for your specific plan right now. But I encourage you to utilize our helpline. You can reach them at 1-844-571-HELP. Call our helpline because they'll be able to give you that personalized and specific attention that can help to directly address those patient concerns that you're seeing. So these are some of the actions you can take. And there's one other that I want to mention. Our team is planning a Twitter chat to take place in the next couple of weeks. We don't have a date set in stone just yet, but we're looking to schedule one, and we'll release that with this webinar recording and our next Advocacy in Action email. So keep an eye on your inbox and stay tuned for more details. And during that chat, you'll be able to get more information, ask more questions, and really dig into all of those concerns and responses that you might have to these types of programs. Okay, and with that, I'm going to turn our dialogue over to some Q&A. So here are some questions that we're getting so far. I'm going to direct this to Anna. Is the money that we're using for copay assistance coming from your insurance company or from someone else?
If you're using drug manufacturer copay assistance, the copay card that you're using, it would be coming directly from the manufacturer.
Good. And if you haven't had any issues as of yet with your insurance, do you still want us to share your story with our story banking system? Absolutely. We have story banks that are set up not only for this copay assistance question, but also for many of our other kind of barriers to care. We have them for step therapy and for out-of-pocket costs, et cetera, et cetera. So I encourage you to check out our Action Center and look at some of the story banks that might best fit your experience and respond to some of those. Here's another question. I am not under an accumulator program yet, but I am concerned that it may happen in the future. Can you elaborate on how they work, how you might be enrolled in one?
Well, I imagine that if you are going to be enrolled in one, when you are going through the open enrollment process, which for most people is in the fall, the disclosure about all of the terms of your plan, it would be included somewhere in there. In some cases, it's been sort of a standalone letter or email. We've seen some copies of these. They're all worded a bit differently, and they don't all even use the term accumulator adjustment program. So that's one of our sort of goals here, is to make people aware about what these programs do, so that if you do ever get a disclosure or see information like this, and you're not entirely sure what it is, you're sort of, you have some keywords in mind, and you know to ask us and use us as a resource in addition to asking questions of your insurer.
Here's another question. Are the people who are having issues only on medications that also have a generic product?
Not necessarily. To our knowledge, these programs are sort of an across-the-board program that could apply to any drug in which you're using copay cards from your drug manufacturer, and it obviously is going to be a little bit different what that looks like depending on the type of drug you're on and if there is a generic or not. One of our focus areas that I mentioned earlier, rheumatoid arthritis, because there isn't a generic for those biologic medications, but that's an area of concern because they are more expensive medications and you don't necessarily have a lower cost option available.
Here's another question. One of our viewers has been told that Enbrel will be reimbursing patients for the deductible cost. Do you have any idea if this information is accurate or complete information?
I would encourage you, if you are on Enbrel, to reach out to their customer service helpline, where they would absolutely be able to answer any of those kinds of questions for you. And that goes for any drug you might be on, whether it's Enbrel or another drug, that each of the manufacturers, they do have helplines as well where they can answer those kinds of questions.
Okay, let's see. Yeah, so it looks like some of those disease-specific or drug-specific questions can be answered by talking to your manufacturers. And some of these real patient-specific questions that we're getting, if we're not addressing them right now, it's because I really do want to encourage you to call our helpline to talk with a licensed clinical social worker who can really address some of those specific patient stories. That'll be a really helpful tool for you all. All right, our questions are still coming in, so let's hold for a moment. Yeah, so again, if you have those manufacturer-specific questions, please be sure to contact your manufacturer directly to get the tools and resources that they have specifically. All right, so I think that for our remaining questions, okay, hold on. We have one more. Let's address this one. I am on a biologic and I have rheumatoid arthritis. I do use a copay assistance, and they did adopt this program this year. Will I be responsible until the out-of-pocket maximum is met? Can we clarify that?
Yes, if you're in a plan that has those out-of-pocket, which is most plans that have those out-of-pocket maximums, while the copay assistance you're getting from the drug manufacturer won't count towards that, your out-of-pocket cost that you're paying after that assistance has been exhausted, once you reach that maximum limit, then your full cost-sharing obligation will be done. I should also note that for government programs like Medicare, where drug manufacturer copay cards are not allowed, this type of program wouldn't apply there, just because there wouldn't be the opportunity for it to apply there.
And I am seeing a number of requests to get copies of these slides, and we can save the slides as a PDF and include that in our next edition of our Advocacy in Action email. So please stay tuned for that email to come out later this month. Here's a good question. What kinds of questions should we be asking our insurer or our HR department so that we can address these concerns that we're having? What are some good ways to approach this with them?
That is actually one of our next steps, is to come up with some template Q&A that you can use in those conversations. We really want to help give you as many resources as possible to have those conversations. If you wanted to find out more about whether your employer is using these programs, you can maybe just start by directly asking. I think, historically what we've heard from patients is that oftentimes they don't feel comfortable talking to their employer because they don't want to disclose health information, personal health information. The thing about these types of programs is they're not specific to any disease area, so I think maybe that could make it a little easier to have a conversation about concerns about access without disclosing actual healthcare information. But we will be working on more resources for you, so stay tuned. We'll be posting a blog in the next day or so that will go into a little bit more detail and have some Q&A as well.
So one more clarifying question, just so that we're all fully clear on this. Does the deductible and out-of-pocket cost, is it payable before or after the copay card limit has been reached?
It would be after.
After.
Correct.
Right. I think we have a couple more questions coming in, so let's just address these ones as well. Are programs like Good RX and similar drug discount programs considered copay assistance that fall under this issue?
Those are different. There are a number of assistance programs that are not tied to the drug manufacturer, so I think it is important to separate those out. And those are some resources that could be available. So if you are caught in a situation where you are charged the full cost of the drug and you need further assistance, there are different programs that are not drug manufacturer copay programs that can offer assistance, and we certainly have some links to some of those that we'll include in our blog and in some follow-up materials.
Okay, everybody, it looks like our questions have slowed down. So at this point, I'm going to say thank you all for joining us today, and thank you for a lively discussion at the end. We will be having some more opportunities for you to ask questions during our blog. There'll be lots of questions and answers and helpful links there, and we will be having a Twitter chat over the next few weeks, and we'll identify the date and time for that in our next advocacy email. So that'll be chock full of good information and resources. Keep an eye on your inbox just for that. And if you have any questions in the meantime, you can feel free to reach out directly to me, and I'll help direct you to the best resource. So my email address is jeller@arthritis.org. My phone number is 202-843-0094. And for our Twitter purposes, you can reach me at JulieEllerAF. Thank you all so much for joining us today, and we're really glad to be able to have this really productive conversation with you all. Thank you so much.